It's the very latest in permanent birth control and controlling heavy menstruation. Here to tell us more about it is Dr. Monte Swarup from Horizons Women's Care. It's good to see you. Thank you for joining us, Doctor.
Yeah.
You know, a lot of women, this is the latest, coolest stuff for... Now, when you say permanent birth control, that means you're done having kids.
Yes.
You've decided this time is come and gone.
This is for when your family's complete. Here, hold your hand out. I'll show you exactly what we're talking about.
This is pretty cool looking. I'm going to show this to Bob here. Okay, can you see that? It just looks like a little piece of wire or metal or something.
Correct. This is called the Essure procedure. It's actually been FDA approved since 2002, and there's been over 300,000 of them that have been done just in the United States since then. And the little white fibers that you see in there are actually what draw tissue from the outside in to grow in and occlude the fallopian tubes. It's just downright incredible. We do these in the office with no hormones. There's no incisions involved whatsoever.
Really?
It's really quite amazing. I was the only doctor actually that went to the world's first Essure summit from Arizona. That was last April, and it was wonderful. There was 90 people there. I was able to meet the chairman of the board, the CEO. The little coils that you actually see there, the lady who's the chairman of the board now, she left a cardiac stent company. And what's really cool about it is these little coils are actually the same coils that are in cardiac stents right now. Some of these have been in patients' hearts for the last 20 years.
Wow.
Well, she took that technology and added the little fibers or threads to draw the tissue inside. And I love to tell patients that story because it's real comfortable for all of us that these implants have been around in people's bodies for many, many years, of course.
Yeah, you want to know that. Now, we have a graphic to kind of explain, because most people, or women, when they think of permanent birth control, they're thinking surgeries, the whole 9 yards.
Yeah.
This is much simpler. So here's a kind of a diagram of it.
Correct. And the little yellow fibers that you see are actually what's drawing the tissue to grow in the tube from the outside in. And then if we go to the next one, too, that's the way that the implant is actually going to sit in the fallopian tube. It takes about 3 months for the tubes to close themselves off, and 3 months later, ladies are suggested to have, it's called an Essure confirmation test. They'll go to the radiology suite, and they will actually shoot some dye into the uterus. We'll confirm that the tubes are closed and that the implants are in the proper position. And at that stage, you can go ahead and trust the procedure.
Wow. And then that's it? You're set for the rest of your life?
It is. And I'm glad you brought that up again. This is permanent birth control for when your family's complete. Essure itself also is starting a big awareness campaign here in Phoenix as well. And a lot of commercials are coming out, print ads, radio, et cetera,
so we're going to hear more about it.
It is. And that's why I wanted to come out and let the audience know, about my skill set in doing this too. So.
Yeah, you're the man. He's the man who's been doing this. He knows all about it. So you're going to start hearing about it. Go, oh yeah. Now we were also talking about something that you have the latest and greatest in is controlling heavy menstruations for women, because that's a tough.
Correct. We have other procedures that we do in office for that as well. It's called Novasure, actually, and we have a little slide to show that also. Novasure also, no hormones, no incisions, and their big tagline is no hysterectomy. The instrument actually goes inside. We open it up, and on the diagram you can see the pink lining of the inside of the uterus. Those are actually the glands that are overactive in ladies who have menstrual problems, heavy and painful periods. The instrument, once we turn on the energy and remove it, we're hoping to cause scar in the area where the glands actually were. So consequently, what's nice is we're only causing scar where we actually want it to be, and we're minimizing the possibility of scar elsewhere in the body. It's downright amazing. There's actually been 1 million of these that have been done all over the world, too. And about 2-3 years ago, we actually brought that in office as well. What else is incredible about this, too, these things are universally covered on insurance. Patients are responsible for their own copays and deductibles, but the pain with these procedures is really relatively minimal as well.
That's what I was going to ask you. What have your patients said once they've gotten that Novasure procedure done? You said a lot less bleeding?
Oh, a lot less bleeding. I mean, 50% of people actually have 0 periods. I can never guarantee anyone that, but I guarantee people that your periods are going to be significantly improved.
Now, can they go on to have kids after that?
Absolutely not, and that's a good point too. And the Novasure and the Essure procedure do go hand in hand. For example, if someone has desires a Novasure procedure and hasn't had a form of permanent birth control, or their partner, we do require that they have some form of permanent birth control. So I can actually do the Essure procedure, and then a couple of weeks later we can come back and go ahead and do the Novasure procedure.
Before Essure came out with this, is that, I'm pronouncing it, this little tube here, what were women doing then for permanent?
Permanent, we would actually have to take them to the operating room, and we would do the little incision in the belly button for a laparoscopic tubal sterilization. Downside of that is no heavy lifting for 2 weeks. Literally after the Essure or the Novasure, next day you can go work out.
Well, plus it's surgery too.
It is. It's much more invasive than the Essure. That's for sure. I mean, people have been trying to accomplish this little thing here for 30 years.
Wow.
And finally, a company hit on the head. This is the most effective form of contraception available right now.
Wow. But once it's in, you're done.
It is. It is a permanent.
It's not
correct. Your family's complete. This is the path for you. And if it's not that path, then we have much other alternatives, of course, available also that we can offer people too, some of which are even what I call brainless and reversible.
Brainless memory. Well, that's when you're young and you're not sure what you're doing yet. I guess that would make sense.
Exactly.
And so, did you have any other slides?
Yeah, we did. We just have some pictures of our office.
Okay, yeah, let's take a look at those, because I noticed when I was looking online too, very comfortable.
We actually, our office is a mile east of Chandler Fashion Center, and we're very proud to offer a facility with a large waiting room. We realize that a lot of our patients bring their families in, et cetera, and there's a big plasma TV that runs your show as well.
Good, thank you.
There's actually a cafe in the middle.
Oh, wow.
When you check in, you get a pager like you do at a restaurant.
Oh, that's a good idea.
Yeah, there's a little child play area.
All of us are going, hey, all right. So when you're waiting, you have something to do.
When we designed the place, when I went to the doctor it's annoying to me that, hey, here's your clipboard, sit down, fill out your paperwork, and come back. And then go sit down, read a magazine, and don't talk to anybody next to you. There's no reason that it has to be like that. This way, if you need to go to the bathroom, change your kid's diaper, or, you're not wondering if, you missed your being called up, of course,
Well, yeah,
too.
and it's a good point, because many women who are going to obviously have their kids with them for many reasons, and so now you can do something with them, get something to eat. That's really a neat idea.
Yeah, and these are the kids that we delivered. We like seeing them, of course, as well, and we wanted to create a more family-oriented environment, so we're real proud to offer that, too. It's turned out to be
nice.
Yeah.
When you go there, you really feel welcome and warm, and you cover every aspect of women's care possible.
We do all aspects of obstetrics and gynecology, and the surgeries that are oriented with it as well.
All right. Well, thank you so much. Really good news and the latest information that's out there for people, so we appreciate you coming on and telling us all about that, and thank you for bringing this to Arizona. You're going to see more about it, and if you do want more information on any of the procedures that we just discussed, of course, you can find it at newhorizonswomenscare.com, and there is the phone number right there on your screen.